Good afternoon, everybody. Thank you for joining me here today. I'm here today with my county attorney, Thomas Humbach, my financial person for the county executive's office, Bob Bergman, and also John Lyon, who has set up the Facebook Live. They're all at acceptable distances away from me. Look, I'm not going to attempt to sugarcoat the situation we face at the moment. We have 42 confirmed COVID-19 related deaths, 42. Over 3,700 cases reported to us by New York State. Granted, some of these may be duplicates, retests, or may have been inaccurately attributed to the county. The fact remains, together we stand before the greatest threat that Rockland has ever faced. And the tools we have used to great effect in the past to protect the health and safety of our residents have been taken from us. During last year's measles crisis, we had autonomy of action. We were not micromanaged by the state of New York. We were supported by the state, and we appreciated that, and allowed to use our own judgment on what was necessary to those best who understand the local needs. We were. And we were able to bring that outbreak to a halt. 2 weeks ago, Governor Cuomo issued Executive Order 202.5, which superseded localities' ability to issue emergency orders related to COVID-19. This was perfectly legal, and it was understandable up to a point. But now we have reached a dangerous threshold, and action must be taken. In 2 zip codes of our county, more than 1% of the population has now tested positive for COVID-19. That 1% figure has been cited as a dangerous tipping point by members of the White House Coronavirus Task Force, further reinforcing the point that action must be taken. The hard-working team of our planning department has drilled further down into the confirmed case data we have from the Department of Health to create this hotspot grid map that shows where the most cases are within Rockland County. And we're putting it up right now. This cooperation is indicative of our entire county government. We are working together with one simple focus: save lives. And please keep this in mind. This map that you're seeing here is based on 1,556 confirmed addresses that were able to be mapped. Our reported case numbers from New York State are now twice that amount. So we are already behind the 8 ball. And we attribute these numbers however you like, to make more people being tested in the areas, or maybe just more people who are getting sick. But the bottom line is that they are getting sick with a deadly disease, and the numbers themselves do not and cannot lie. If I was able to take decisive action through emergency executive order, I would have already done so, but because I truly believe that more must be done to protect every member of our Rockland community. Therefore, I am emphatically requesting that Governor Cuomo implement a containment zone here in Rockland. As you did in New Rochelle, Governor, you have taken unprecedented action in the face of an outbreak, and I'm asking you to, again, show that leadership and do so here to protect the residents of Rockland County. The details of the containment zone can take any form or any shape. It was done before, so I will leave that to the governor. But the bottom line is this: this must be done. New Rochelle, thanks to the governor's efforts, was holding at less than 400 cases at the end of March, thanks to that aggressive action. As we now have far more cases than that in just these 2 zip codes, 861 cases. We need you to take decisive action now to protect all of our residents, because right now in that area we are well past the 1% tipping point. We're at 1.73% of the population. A few days ago, the governor's staff dismissed the idea of a containment zone. This is why I'm now asking the governor directly, because if we do nothing, even more people will die. As you know, if you have listened to the governor's press conferences, strict compliance with social distancing measures will reduce the number of people who get sick. That's a fact. It will reduce the number of people who die and prevent our hospital system from being overwhelmed. Unfortunately, despite repeated pleas from elected officials, health experts, and community and religious leaders, we are not seeing the levels of compliance needed to flatten the curve to a manageable level here locally. In fact, the numbers are telling us quite the opposite. I'll give you a simple example. Right now, I got called yesterday by a friend of mine who from Pearl River, who was going to bury a friend, and people who knew him wanted to show up and spend time with him. to say goodbye. And I explained to him, look, times have changed. We don't have the ability to have mass gatherings anymore. But he was simply asking for a thought of having a half a dozen people stand with sashes respectfully away from each other just to say a final goodbye to the gentleman who was being buried. And that was a reasonable thing to do. In other areas, we have an attorney here in Rockland County whose father-in-law passed away. From the beginning to end, whether it be the wake of the funeral, there were restrictions placed on gathering, spacing. It was not what it used to be. It was not what it always was. And that is just what we're dealing with now. However, we just recently had a couple of funerals in this area publicized where many, many people showed up and there was no distancing done whatsoever. And that has gotten people very angry, very upset. But what I'll say this, you're together to bury a loved one. And what's going to happen here with these reckless actions where people come down in mass to funerals and wakes, and what's going to happen is you're going to see you burying another one of your loved ones from that crowd. As of yesterday, our Department of Health has received 160 complaints related to possible violations of Governor Cuomo's executive orders. And as I explained yesterday, we were unable to enforce those by the local police departments. Where have these complaints originated? Town of Stony Point had 1 complaint. Haverstraw, 12 complaints. Orangetown, 14 complaints. Clarkstown, 25 complaints. The town of Round had 108 complaints. These numbers tell me 2 things. 1, people are violating social distancing guidelines all across our county, but we all need to do better. Stay home, people. But 2, and clearly, more needs to be done in the town of Roundpole. I have heard the Roundpole supervisor say that he has done everything possible to halt the spread of this disease and encourage people to stay home. Clearly, this tactic is not working. And the one thing that he or anyone in his administration could have done would have been respond to these funerals and educate his constituents on how to mourn while respecting the crisis in our time. This is why the governor's immediate action is so critical. These things are not happening. I do hope that the supervisor will join me now in this call to the governor for a containment zone within this town of Roundpole. Now is no time to play politics. People's lives are at stake. We are proposing a rough boundaries of this containment zone to be set where the numbers are prevalent. Route 45 to the east, Grandview Road to the north, College and Forshey Road, Road 81, County Road 81 to the west, and the New York State Thruway to the south. The governor's been asking daily during his press conference, what is it going to take for people to comply? He's been very passionate with that. The answer, Governor, to me is quite clear. Actual enforcement of the executive orders must take place. They are being ignored way too much. And as I addressed yesterday in a statement, the police cannot concurrently enforce the governor's orders. We need local enforcement power returned to us here in Rockland and across New York State before it is too late. As a former police commander, I will say that a proposed task force in Albany, as I've been hearing, will absolutely not cut it. Additionally, I am once again requesting that a temporary hospital be established here in Rockland County. As these cases continue to grow exponentially, our local capacity will soon be overwhelmed. The Rockland Community College Field House is listed as a possibility in our emergency operations plan, but we are open to other ideas as well. Time is of the essence. We must set these wheels in motion now. We have received an offer from local hotel to house doctors, nurses, first responders, and medical personnel. Governor, you have said you have 78,000 medical volunteers have come forward at your request. We have a place for them right here, and more importantly, a great need for additional assistance. Please help us prepare to fight the battle, as you say, from the top of the mountain, because where we are now, it will be starting to slide down a slope. We will today be submitting a resolution in support of these requests to the Rockland County Legislature after this event concludes, and I'm asking passage in support of the people of this county. Additionally, I'm asking that each of our town supervisors and state assembly and senators issue public statements in support of this effort. Failure to do so will be quite telling to our constituents. I can say already, since a couple of phone calls came in, Assemblyman Ken Zabrowski has already signed on to this effort. So is Supervisor Jim Monahan and his Stony Point Town Board, and Lon Hofstein of the Rockland County Legislature, and all the members of the minority. And I do want to thank them because it's important that the people here that their political leaders are united as one to combat this disease. Residents also are welcome to call and email the governor's office in support as well. We need your voices to be heard also. We need a response from the governor before Friday, tomorrow, because that's how quickly this is rising. My numbers changed 3 times this morning. It is a sobering moment here in Rockland. But if we need this answer immediately from the governor. If we do not get a response, we are going to be going to the White House, to the Coronavirus Task Force, and asking them for assistance. Because as of Sunday evening, Rockland's need, as per Dr. Deborah Burks, who was the coordinator, identified our county and Bergen as some of the fastest growing areas in the entire country per capita. We have faced great adversity before and prevailed. I have no doubt that we will prevail again. The only question remains is how many lives will be lost unnecessarily along the way. That is something I will move heaven and earth to prevent. To the residents of our great county, I please ask you to stay home. Practice smart practices when it comes to hygiene and social distancing. Stay home to give our doctors, our nurses, our medical personnel, our first responders, heroes all who've been out there in the front line, a fighting chance at having equipment, time, and the resources they need to take on this challenge, the greatest challenge we faced here in Rockland. Please do not do your part to protect those on the front lines and those who are at greatest risk. Stay home for your mother, your father, your grandparents. Help us protect our children, our families, and our neighbors. We are all in this together, and it is together we will beat this virus, and as I've said many times before, with adversity and success to that challenge, we come out stronger than ever before, and I truly believe that. We just need help right now from the state and local level of government. But with that, I know we probably have questions from residents and the press, I believe.
We do have a few questions coming in, some directly related to what you spoke to, and a few other that are off topic. I'm going to take them in the order that I received them. So, can you give us a brief update on the status of Rockland's hospitals? What's happening here locally? People are concerned that
I understand that concern because people are reading about people getting sick, and they're concerned that if they get sick, what would happen? Or their family gets sick, what would happen? Please be assured that we have daily contact with Dr. Mark Geller of Montefiore Nyack, and also at Good Sam Hospital, Dr. Mary Leahy, the CEOs of both facilities. They've assured me that the situation, while challenging, is manageable. As we have seen from the daily briefings of the governor, that the people who are being discharged as compared to people who are intake is kind of leveling off. So there seems to be a balance right now to some degree. But we stand ready to render whatever assistance we can, but right now we are not at a critical mode. But here's the thing, if we don't address this rapid rise immediately, we will not have the comfort level to say something like that. This is why it is so critically important that we initiate a containment zone, that we combat this virus on the ground and win this battle now, because if we don't do it now, we may not be able to have the same confidence in our hospital abilities a week or two from now.
A question a little bit about the statement that was released yesterday. People are asking, can the sheriff's department be used? Can other law enforcement resources help with this and enforcing social distancing?
No. And that has been a challenge the sheriff has brought to me. The District Attorneys Association of New York State has been very clear. They said that the ability for law enforcement to react and enforce these rules are non-existent. I think they call them helpful hints. And as we said, this is not a cooking show. This is life or death. So we need to have that local authority here. And again, I know there's been talk about a task force in Albany. I appreciate the effort, but what is it going to accomplish? We don't need a task force in Albany. We don't need more poetry here. We need an ability to do what we have to do here, which we've done before. And again, like I said earlier, we beat the measles epidemic because we knew what to do. We knew we had the local understanding of what's happening here that the state did not have. And the state did the right thing. They gave us the tools necessary for us to do our job. That's exactly what law enforcement, our first responders are looking to do now.
Absolutely.
And our health inspectors too.
And I have a couple questions, people looking exactly what you think should be part of this containment zone. You defined the area.
Right.
What are your expectations or what are your thoughts on what should actually happen there?
Well, my thoughts are, why reinvent the wheel? I mean, obviously, this was initiated in New Rochelle. There was a format to doing that. They may want to tweak it this time and do it somewhat differently. That's up to the governor. I mean, you know, why would I want to recreate what he's done? All we know is it was successful, and I see simple things such as ensuring that people are socially distanced as a matter of routine within that containment zone. Any gatherings are broken up immediately, or at least people are educated, as I said earlier, at a funeral. They're educated to stay 6 feet away from each other. There's an understanding. We work with community leaders. I spoke to Rabbi Rottenberg today about this very issue, that we have respected community and religious leaders to make sure that people understand we don't want a death to result from a burial. That is just something that obviously we don't want to see. Stores need to understand, just like you have ramp metering on the highway to minimize cars bunching up, stores cannot take in everybody at one time and basically make it impossible to have social distancing. So see, these are some of the things that can happen, and these things work. I mean, it's been shown that this one thing alone, with proper hygiene, making sure your hands are clean, not touching your face, those simple things can stop this virus in so many ways. And it's a simple thing to ask, but unfortunately it's not happening. So we need the assistance of whatever enforcement area and educational area can happen, but we have to move forward.
Okay. Those are the only questions I've received thus far. If there are members of the media who have additional questions, please submit them to my email, and I will follow up with you later today.
Okay. Thank you very much, everybody.